Hello, good day to you. It's Andy and Talkin really. And this story caught my eye yesterday, and it was Handjob has decided to scrap Public Health England. So it is independent. Matt Hancock has confirmed the government will axe Public Health England and create a new National Institute for Health Protection. Despite the move being branded irresponsible during a pandemic. The Health Secretary also revealed that Baroness Dido Harding, the current head of NHS Test and Trace, that useless service that was funded, and a Conservative peer, will become interim head of the new organisation and is expected to start work immediately. Call me stupid, but I thought Dido was a singer. Most famous song, White Flag, surely. Why is she suddenly head of health service? Not sure. I am joking, of course, because as we all know, the real Dido, Baroness Dido, is a peer and a Conservative, of course. Who else? Let's keep it in the family, shall we?
Dear Baroness Dido Harding, I see that now Matt Wanksock has decided to dismantle Public Health England in a desperate attempt to find a scapegoat for his and his colleagues' utter ineptitude. He has appointed you as the head of the replacement organization, a medical body which will need to have public health and data governance at its heart. Tell me, what was it on your CV which won you this role? Was it your clusterfuckery in setting up the dreadful track and trace program? Was it your role as chair of NHS Improvement, an organization with the least accurate name known to humankind? Was it your role as CEO of TalK, an organization which demonstrated the worst leak of customer data ever recorded at the time, losing the company £60 million, and for such appalling data governance ended up with the largest fine ever set by the regulator? Was it your senior role in the Jockey Club, the organization which failed to cancel this year's Cheltenham Festival leading to countless cases and deaths from COVID-19? Or is it the fact that you were married to a Tory MP who is one of Jeremy Hunt's mates? Do let us know.
Anyway, Matt Hancock has decided to axe Public Health England, blaming them, as we all know, blaming them for everything to do with the whole scamdemic, the figures that they produced, etc., and the fact that they have to backtrack. Yes, quite a lot of backtracking on numbers, and of course, PHE was responsible for all of that. They're going to try and sort of, what's the word I'm looking for, bullshit you with the next comments we have, because Matt Handjob has said that the new NIHP will have a single and relentless mission to protect the country from external threats, including infectious diseases, outbreaks, and biological weapons. That's the only thing we need to be afraid of is what's already in the country, I think, myself. And then he says, my single biggest fear is a novel flu or another major health alert hitting us right now in the middle of this battle. Yeah, right. And then he says, even once this crisis has passed, and it will pass, we need a disease control infrastructure that gives us the permanent standing capacity to respond as a nation. Yeah, right. The Department of Health and Social Care, DHSC, said from Tuesday the new organisation will bring together PHE, NHS Test and Trust, and the Joint Biosecurity Centre, JBC, whatever. And it will also report to the Health Secretary, Matt Handjob, and support the UK for chief medical officers. And why have we got 4? Why do we need 4? In order to minimise disruption to the vital work dealing with the pandemic, the organisation will be formalised and operating from spring 2021. The Health Secretary said to give ourselves the best chance of beating this virus once and for all is probably just to turn off your TV and of spotting and being ready to respond to other health threats. Now and in the future, we are creating a brand new organisation, wasting more money, probably. You wonder about that. Who is getting paid for that? Well, obviously this Conservative Baroness is probably being paid. Mr. Hancock said that Baroness Harding will lead the new organisation. She's also the former chief executive of Talk. Ah, interesting. Appointed earlier this year to lead the government contact tracing programme. Interesting. The scheme relies on identifying people who have been in contact with positive corona cases. And it was also a story that came out that Serco got paid loads of money for doing this job, and basically they inept and useless. The PHE was established in 2013 and been at the forefront of the crisis, with responsibilities including preparing and responding to emergencies and encouraging the public to lead healthier lifestyles. So obviously, clearly, that's why it's getting disbanded, because it hasn't done the job. Earlier this week, Duncan Selby, the organisation chief executive, apologised to staff that news of the demise of PHE was first briefed to the media, so the staff did not even get told they were sacked. The media knew first. In a note to staff seen by the Health Service Journal, the chief exec said the Prime Minister and Secretary of State wish to recreate an organisation with the sole focus on health protection. Right, that's it then. That's the story. Hope you enjoyed it. And, of course, you had a little bit of a laugh on the way. Have a good day and bye for now.